The video that you're looking at here is from the House Government Operations Committee. It's regarding HB0164, which was the caption bill that was to reduce the amount of time the veterinary board had to respond to an applicant from 60 days down to 50 days. Just a little over a month ago, probably about a month and 3 or 4 days ago, this came to committee, and when it came to committee, there was an amendment on it to basically give animal chiropractors, which are human chiropractors that have taken a 210-hour American Veterinary Chiropractic Association program, the ability to be portal of entry providers for animal care, therefore basically giving them the ability to practice veterinary medicine as it's stated under current law. Of course, they're trying to change that current law. I'm going to let you listen to this this discussion. It's 5 minutes long. I'm going to break in and kind of, I guess, put my 2 cents worth in on a couple of things that are stated. And then I'm going to, toward the end, for one, there's very little discussion in this. It basically is just like the bill itself. It gets pushed through without any real discussion based off of the technicality, as you'll see. But even in some of the meetings where there's been discussion, there's been some interesting commentary made. So I'm going to put a few little cuts of other committee meetings on here at the end so that you can hear some of those statements. Here you go.
Item number 3, House Bill 164 by Marsh. We have a motion and a second. Speaker Marsh, you're recognized on your bill, sir.
Thank you, Mr. Chairman. This bill today deals with animal chiropractors. We love our vets and we love our animal chiropractors. The primary purpose of this bill is to establish educational standards which must be met by chiropractic physicians and veterinarians who perform animal chiropractic work. Chiropractors and veterinarians that receive additional training and certification in animal chiropractic care should register with their boards and be able to provide chiropractic care on animals.
So far, we don't disagree too much. There's not a lot of chiropractic teaching in veterinary school, although it is sometimes an elective course, or you can go on your own to continuing educations or wet labs to learn more about it. But it is, once you do that, if you feel comfortable doing it, it is within the purview of the current Veterinary Practice Act statute that you could perform it. Very few veterinarians do this. It's not heavily advertised. That's kind of one of the things that they are making a big deal out of. The chiropractics are, but it's really not that common. Most of the time, it's done by either veterinary chiropractors who have taken a similar course, either AVCA or IVCA. This would actually potentially, depends on how the chiropractic board wants to handle it, it could actually knock a veterinarian or two that have International Veterinary Chiropractic Association certification out of being able to practice. So, and it may actually not qualify people out of practicing chiropractics, unfortunately. So we'll keep moving on.
Animal chiropractors have been performing work like this in Tennessee for over 100 years. They've been certified since 1989. They have to have 4 years of college education plus 4 more years of chiropractic degree, and then at least 210 extra hours on how to work on animals. The problem we're having.
So it's been going on for over 100 years. Certification, at least the AVCA started certifying as of 1989. Yeah, that's true. That doesn't necessarily mean that there's been a slot for that in Tennessee. The AVCA, which is the group that they're actually wanting to use as their certifying group, they actually have within their guidelines that a animal chiropractor is to practice within the laws of the state in which they're practicing. That's one of the few things that they use as a guideline. And so when he says that people are practicing, he means one of two things. And in different committees, you'll hear kind of different things said, but either a certified animal chiropractor is practicing under the supervision or referral directive of a veterinarian, in which case I think in most instances that's allowed, especially in direct supervision, but probably even under referral if it really came push to shove. And that's where some clarification is needed, but it is not needed with this albatross cookie, one size fit all treatment here. Number two is you could have animal chiropractors that are seeing animals without veterinary referral or supervision or directive, in which case they are by statute practicing veterinary medicine, and that is a Class B misdemeanor. So if you go to the veterinary codes here, this is 62-12-103. That's Tennessee state statute. Practice of veterinary medicine. You can see diagnose, treat, correct, change, alleviate, prevent animal disease, blah, blah, blah. And then also the use of complementary, alternative, and integrative therapies, and that's where chiropractic would stand in. So it's basically within our private practice act to be able to do. When you come here to penalty for unlicensed practice, which would be what is happening when they say it's been going on. Any person who practices or attempts to practice veterinary medicine in the state basically commits Class B misdemeanor. To take it one step farther, and they say it's been going on, the chiropractic board itself, it's kind of got a scope of practice here you can see. And when it comes to diagnosis, it means coming up with a differential diagnosis of human ailments through exam and evaluation of patients, blah, blah, blah. There's really nothing in there about veterinary care. And then coming on over here, which that's what they're wanting to change. They're wanting to add animal chiropractic under the chiropractic purview. If you come to this is 63-4-114. It's denial, suspension, or revocation of license. It basically says the board, and this is the chiropractic board, has the duty and authority to suspend for a specified time within the discretion of the board or to revoke any license to practice chiropractic or otherwise discipline licensees or refuse to grant a certificate of fitness whenever the licensee or applicant is found guilty of any of the following offenses. If you run down to number 14 on that list, you will see that invasion of a field of practice in which the licensee is not licensed to practice or is not within the limits of the licensee's respective callings as determined by the board. So that means that when you have a chiropractor who is invading into the veterinary practice unlawfully, then their own chiropractic board has a duty and the authority to deal with that, but yet they've refused to do so. And so whenever Representative Marsh talks about how this has been going on, and whenever the TCA vice president and executive directors come to committee and say, well, we know this has been going on, and they've repeated this in multiple committee meetings, that we've got chiropractors seeing animals. What they really mean is, we know it's been going on, it's illegal, the board's not really been doing anything about it, and we want to basically give them amnesty or expand their abilities so that they're no longer violating these provisions. So that's frustrating for me, because now we're wanting to put this under the purview of the very board that hasn't been doing its duty, it would appear. Continuing on.
Here is some of the veterinarians, and the veterinarians and animal chiropractors work together on a lot of things, but some of the veterinarians were saying that these animal chiropractors could not work on an animal unless the animal was taken to the veterinarian first. We're saying these animals are private property, and the owner should have a choice to take them wherever they would like. If they want to take them to a veterinarian, that's great. If they'd rather take them to a animal chiropractor, that's great. So that's what we're saying, as long as you've got your own rules and regulations and your boards, that they both can coexist peacefully. With that, I'll answer any questions.
That's cool. So talking about animals being private property, that is a little bit of a complicating factor, considering that they're living creatures. They're not the rusty tractor sitting out in the backyard. So if we set this precedence that owners could do anything they want to with their animals because it's their private property, that would indicate that they don't have to feed them because it's their private property. What can you say about it? They don't have to water them. They don't have to provide them shelter. They don't have to provide veterinary care appropriately. So if they're full of parasites to the point that it's causing them to be emaciated or starve to death, or a number of other things, collect edema underneath their neck or in their lungs or in their abdominal cavity because of low protein from the parasite loss, protein loss, anything like that is basically justified under this guy's way of thinking. And he's from Shelbyville, right? That's Tennessee Walker territory. So under this mentality, they'd be able to soar those horses so that they walk in that gait that they prefer without any retribution if we want to go based off that same logic. So it's a very flawed logic. Best medicine would be that an animal come to the veterinarian where the veterinarian's had 20 times the amount of training as far as time-wise in veterinary illness, diagnostics, that sort of thing, compared to a chiropractor who's taken a 210-hour course in animal chiropractic. And let that animal be evaluated. Honestly, it would probably be evaluated under more scrutiny if it was going to go to a chiropractic's office, because the veterinarian would have the duty of making sure that there's nothing obvious that could be harmed by chiropractics, that there's no bone tumors that might pathologic fracture under stress, or a multiple myeloma type of issue, or a splenic tumor that might rupture, things, herniated disc that might be worsened. So things like that, where chiropractics can cause harm. And so, veterinarians do think that needs to be referred, versus, one of the arguments here is that vets just, want the exam fee. And it is a revenue loss for vets if an animal's going somewhere else and not receiving appropriate care. But it's a loss for the owner too, because the chiropractic's not free either. So they're essentially going to get charged by the chiropractor and the vet if the chiropractor sees them first and then refers them to the vet. Same thing if they go to the vet before they go to the chiropractor. So it's really kind of a equalizing argument, I guess I would say. Also, I guess, like I said, I'll let you finish up. You'll see how this breezes through here over the next few minutes without any discussion. And then, like I said, I'll cut in a few other things that have been said in other committee meetings so you can get more info.
Okay, thank you for that. Representative Fritz, you're recognized, sir.
Question for positive recommendation. Motion for positive recommendation.
Oh, we've already got that. Chairman Reedy, you're recognized.
Move previous question.
Previous question's been called. We have objection?
I got a point of order.
Point of order. You're recognized, Representative McKenzie.
Thank you. I think I just heard you say that the initial motion was for a positive recommendation. That was not in the motion. The only thing you said when you called the bill was a motion and a second. I don't know if you're saying that's implied, but those words were never uttered on this or the last bill, which was going to be my subsequent parliamentary inquiry on that one. So I don't know how you got from the introduction of the bill to saying that the positive recommendation is already in place. That's my inquiry.
As we've done so far this session, when we've called up a bill, it has been for a positive recommendation, and then if you choose to vote negatively, then it receives a negative recommendation. You're recognized.
Mr. Chair, I've been out here all year. I think what's happened in the other bills, we've introduced the bills, we've discussed the bills, and then there's at the end, what we will hear was motion for positive recommendation, second, and then we vote on that. Those words were uttered, dare I say, in 90+%. I'm going to say all, but I don't want to say all. I missed the meeting. But that's been the process heretofore.
And in our Joint Government Operations Committee meeting, you would be correct, sir. Yes, sir. Representative Parkinson.
Thank you, Mr. Chair. And along those lines, that's the reason why I was asking what we were voting on earlier when we had that vote, because I thought that when a motion is made to hear the bill. And I didn't know that it was, and it could be my fault. I didn't know it was implied that, it was a motion for a positive or a negative recommendation. Thank you, sir.
Thank you. So we have we've taken care of that current standing. We've got a question on the bill is the last motion that I heard made. Do we have any objection? Seeing none, we're on the bill. Mr. Clerk, open the board, please. Anybody wish to change a vote? Clerk, take the vote, please.
Mr. Chairman, the vote is 13.
Just like that, it passes 13-2 with no discussion, no objective or subjective back and forth. Just we'll take your word for it and move on. All right, I'm gonna pause for a sec and come back in here with a couple other video cuts to make a few points. All right, this is from the Health Committee. He's going to talk about how the AVCA recommends that an animal be current as part of their standard of care. He's also going to mention his expertise or animal chiropractor expertise when it comes to internal stuff like splenic tumors.
Secondly, chiropractors are trained to palpate the spine. If the dog that she talks about with the splenic tumor had come into the chiropractic office for an evaluation, the spinal dynamics of musculoskeletal problems would not be apparent, just like they aren't apparent on a human that comes in to see me with an internal pathology. It's quite evident for us to see whether this is a spine problem or this is another problem. Third thing, the AVCA standards require that all animals that we take care of are in good standing with their veterinarians. We can't see them without knowing that they have been seeing their veterinarian on a regular basis, getting their shots, seeing the farrier for their hooves to be trimmed, to make sure that these animals are getting the care that they're supposed to from the vets first, and then we augment by adding the musculoskeletal component to that. So those are three important aspects.
One.
All right, so to kind of address that, I'm going to pull up the American Veterinary Chiropractic Association website and show you a couple of things here real quick. And then I'm going to show you another video where he basically actually, I'll show you the video first where he contradicts this statement. All right, this is from the Agriculture, Energy, and Natural Resources Committee meeting, and this is going to show a contradiction to the last comment made by the Vice President of the Tennessee Chiropractic Association.
Question to you is, what is wrong with the veterinarians who have prepared themselves for sending you an animal if they need to send you that animal, or vice versa? But since you all are not veterinarians, why would you want to start chiropractic service on an animal when you don't know what the diagnoses are? That's what I can't comprehend, because we do that for human beings. So we're setting a precedent here. I've been on this committee for years, and we're about to set a precedent that I don't think is going to be good for us in the long run, because we do care about our animals. Those of us who have, we care about them, and we care about them just like we do humans. So we're about to do something for animals different from what we do from human beings. Last week, I made this point, and I'll be brief, that my doctor sent me to a cardiologist for my heart because she doesn't know anything about hearts. But I went to her first. I had to pay her. So I don't know why money is the issue here when we want the best for our animals. Can you answer that question?
Thank you, Representative Shaw. I appreciate you very much. That's an excellent question, and here's the way we'll answer it. Chiropractors are portal of entry healthcare providers for humans right now, and we're asking for you to allow the animals to be allowed to see the chiropractor as a portal of entry healthcare provider as well. We diagnose patients every day in our offices, and we send them to cardiologists and GI doctors and different doctors on a regular basis. And
Animal chiropractors do the very same thing. They diagnose the animal, they find out what's wrong with it, and they refer the animals to the veterinarian that need advanced care or medicine or surgery. Representative Alexandra had a great point earlier when she talked about the anterior cruciate, or the Dr. Marion. The anterior cruciate tear is an easy diagnosis for a doctor that's trained in veterinary training, and also for chiropractors that are trained in veterinary diagnosis, because that's an easy diagnosis. You don't have to have an x-ray machine for it. Actually, x-ray machine just tells you if the joint structures are intact, but the ligaments don't show up on x-ray. So it's a
He goes on to say that in a case like that, they would refer to back to the vet or to a veterinary specialist. But to kind of address that, port of entry would mean that they could be seen without a veterinarian being involved, which would contradict what he just got in saying about an animal needing to be current with their veterinarian. So that's just one of a few contradictory things that they keep saying. They can't seem to keep things straight. As far as this idea that they will refer things back to the veterinarian if it's beyond their scope, as you could hear earlier, he talked about how the spleen would be an easy thing to diagnose, or at least they would know it wasn't spinal. But I think that's a little bit of a concern too, is exactly what is chiropractic care, because they do mention it being spinal manipulation, joint manipulation, that sort of thing, but it's not that clear cut, because when you go to the certifying body that they're looking at's website, as was neatly pointed out by Dr. Cellini in a recent Instagram post, there's plenty of stuff here that's not related to neuromuscular. So why animal chiropractic? Of course, you got the neck, back, leg, tail pain stuff, but then you've got stuff down here like post-surgical care, bowel, bladder, and internal medicine disorders. Well, would a splenic tumor be an internal medicine disorder? Would they potentially try to do some sort of chiropractic treatment for that? Healing and helping with chronic internal medicine disorders. So is that going to be chiropractics for kidney failure cats, or like where's that going? Indications for care would be things like surgery that involves anesthesia, or seizure activity, which who knows why you would do that. Neurologic problems, recovery, geriatric household pet behavior or mood change. I mean, maybe you could help a cat that's peeing outside the litter box if it's arthritic related. That's questionable. Signs of navicular disease or laminitis, which if you talk to some vets, they would tell you that's a direct reason not to go to a chiropractic first, because if you're late on treating something like laminitis or founder in a horse, then you've pretty much doomed that horse, especially if they start stinking or something. So that's the reason why veterinarians would prefer to see animals first, because quite frankly, as demonstrated by his discussion about the spinal malalignment not being evident on splenic tumor, so we'd refer it. Well, that particular instance that she was talking about was a Boston Terrier, and if anybody's ever seen a Boston Terrier spine, you'll it's like a pug or a Frenchie or whatever. It's not always that aligned, if you could say. But on the other side of it, he talks about a cruciate tear here, right? About it being an easy diagnosis, blah, blah, blah. But cruciates are often easy if they have a cranial drawer sign, which is where you can plop push the tibia out past the femur with range of motions of the knee, or with manipulation of the knee. But that sign isn't always evident, especially in fat dogs, large dogs, dogs that are anxious and really tensed up and they have a lot of muscle there. They can sometimes tense up to the point that you can't really feel that cranial drawer sign effectively without sedating them and allowing their muscles to relax, in which instance a chiropractor who cannot do that sort of sedation work would miss that diagnosis. So I would encourage our General Assembly members to think about this more intently. When it comes to animal chiropractics, there is there's some concern on how effective it is because it's so subjective. It's hard to find objective evidence that it helps. But there are cases where it can harm. And contrary to what the vice president of the TCA said when Senator Pody asked her if they believed there was any harm that could be done to an animal whenever a chiropractor sees it without a veterinary, seeing it ahead of time, and her answer was that they do not feel like harm could be done, then that kind of arrogance is concerning to me. One other thing I would say, other than the best medicine approach, which we've already talked about that, let's kind of go back to the wallet thing. Part of this issue is that people like sponsor Marsh would like to make you think that the vets are just in it for the money. And yes, there is definitely money that is involved with an exam, plus or minus diagnostics. And if you take away the ability of vets to make a living off of evaluating animals for musculoskeletal disease by allowing chiropractors to do it, you're doing a couple things. One is you're definitely adding revenue for them. You're possibly adding extra revenue for them because they may treat it 3 or 4 times before they realize whatever they're doing isn't working and it needs to go to the vet, in which case now you've added the vet expense on top of the chiropractor expense. And then because of that delay, it may even be more expensive for them, plus the loss of revenue for vets over time if enough chiropractors started doing this, which as of right now it probably wouldn't affect us too much, is that other veterinary costs would have to go up because you have to make up that gap somewhere. And, why do you have to make up that gap? Well, you have a lot of expenses in keeping up a veterinary clinic. There's plenty of fixed expenses, that sort of thing. There's a lot of cost to hiring a veterinarian. And the reason veterinarians like to make a little bit of money is, as you can see, cost of veterinary school per year isn't cheap. So University of Tennessee, it's about $34,000 to $35,000 a year right now for 4 years. If you're out of state, it's going to be closer to 62,000, somewhere there. Actually 63, I can't add today. And then if you go, let's say, to Lincoln Memorial, which is the other kind of school within Tennessee, and I'm mostly just talking about in-state Tennessee people here, but Lincoln Memorial has the tuition that's $61,000 a year. So, and then your indirect costs, which are your cost of living, kind of, that stuff happens everywhere no matter what. But moral of the story is that a lot of people come out of school with, $150,000 to $200,000 in debt from just the veterinary school alone, not counting their tuition too, not counting their cost of livings or their undergrad degrees or things like that. So it can be a very expensive upfront endeavor, and when you start cutting revenues, starting letting other practices come in and be portal of entry care for your veterinary patients, then what is the incentive for a person to get a veterinary license? You're already under an insane schedule. You're already under a lot of pressure. There's a lot of compassion fatigue and burnout, suicide rates within our profession because it's high expectations, and the pay's good, but when you have your legislature basically undercutting you like this to allow a profession that has a 20th of the training that you do to do your work as a portal of entry provider, that doesn't bode well for the future of veterinary medicine, especially when the schools are charging an arm, a leg, and a firstborn to go. So another collateral damage that would come of doing legislation like this, especially if you start having other human medical professions start cutting in as well, because they're using that as their justification. Chiropractor has 4 years of a medical doctorate, so they know how to do this and that. And then one last comment, as you overheard him say, chiropractors have a history of making diagnosis and stuff. Again, under their own board definition of diagnosis, it is diagnosis of human ailments. not veterinary ailments. And the reason for that is because they have no veterinary training. The vice president there, the gentleman that speaks for the TCA, he likes to say, and I heard him say it in 2 different committee meetings, that one of the first things he did in his doctorate degree program was dissect a cat. That doesn't mean that every 8th grader that dissects a dog shark is a marine biologist. So let's just drop that stupidity already. Again, this is a bad bill. It's bad medicine. It's bad for the veterinary profession. It's unfortunate that they won't give veterinarians the time of day or listen to the arguments. It's unfortunate that veterinarians have not spent the kind of money that TCA has in lobbying these individuals so that they would pay attention to us. In the past 5 years, the TCA has put $712,000 or so into lobbying versus about $265,000 by the TVMA. And it shows in these discussions, it shows in a lot of ways. So again, if you're a legislature and you're hearing this, you should really objectively think about this rather than just going with the flow on it. This is bad legislation. If you're another person, a Tennessee resident listening to this, please reach out to your legislative representatives and ask that they vote against this when it goes to the floor here in the next week or two. Thank you.